The decidual reaction, or deciduosis, is something that occurs during pregnancy, and it is thought that it is the effect of progesterone on mesenchymal cells that causes the decidual appearance of the affected sites. Sites where the decidual reaction may be seen include fallopian tubes, the cervix, ovaries, appendix, lymph nodes, and the peritoneum. The problem with a decidual reaction is that the appearance may be quite alarming until you realise that it is actually decidual you're looking at and not metastatic cancer, for example, in a lymph node. Perhaps the most common site that the decidual reaction is seen as an incidental finding are the fallopian tubes that have been transected during sterilisation after a caesarean section, and the histological features are nodular collections of decidual cells covered by flattened epithelium. Here is a low power view of a section of fallopian tube that was transected during a caesarean section for sterilisation. And some of the folds of the fallopian tube appear to be a little broader and contain very pale staining cells. On higher power you can see that the pale staining cells have a decidual appearance and the overlying epithelium is flattened. And this is the typical appearance of a decidual reaction affecting the fallopian tube. When a decidual reaction involves the cervix, the clinical appearance is usually that of yellow or red raised areas that are friable and bleed easily, and the problem is that this could be misinterpreted as cancer or pre-malignant changes. This is a low power view of a cervical biopsy, and the stroma has a rather pale appearance. On the higher power you can see that the stroma is composed of cells with abundant pink staining cytoplasm, and on a higher magnification you can see that the stroma has the appearance of decidua. This is deciduosis, or a decidual reaction in a cervical biopsy. The problem is, of course, that these cells have a rather squamoid appearance, and to the unwary could be misinterpreted as invasive squamous cell carcinoma.